moderator for the session, Mr. Tanmay Saxena, Chief Operating Officer, 1MG. And now welcoming our panelists, we have with us Dr. Ajay Nair, Chief Executive Officer, SWAST, Dr. Harshit Jain, Founder, Dorsey, Mr. Ashutosh Lavania, Co-Founder, Amfine. I would request all the delegates to keep posting their questions and the chat box, and the panel will address selected few at the end of the session. Over to you, Mr. Saxena.
Thank you so much, Aparna. Good afternoon, gentlemen. I think we have a very diverse, experienced panel, particularly in a topic that has become very relevant in recent times. Digital health is something all of us probably have looked at and have talked about, but the importance has become, or the value has become much more imminent post the crisis and the pandemic. And which is why I just want to start first with building some context, because all of us are trying to solve challenging healthcare problems in the context of the Indian healthcare ecosystem. So it's very important to sort of get your view on, what is the problem or what is the opportunity that you're seeing, and in your unique ways and efforts, how are you trying to solve it? So let me start with Dr. Nair. And I know that SWAST initiative, and I've been sort of familiar with it. But would love to share, because it started more like a study platform during COVID times, but I think it's evolving into much, much more. So Dr. Nair, if you can sort of talk a little bit about SWAST and the problems.
And thanks for this opportunity. As you rightly said, SWAST evolved out of a move.
I think there is at least some connection. Can you folks hear Dr. Nair, or is it just problem with my end?
Is this better?
Yes, this is better.
Yes. Better.
Apologies, I had some connectivity issues. So as I was saying, SWAST came together as a movement of volunteers who started building out a telemedicine platform as the pandemic was really starting. As this group came together, what ended up happening is that we were able to create this very diverse grouping of traditional healthcare companies, as well as the newer health tech companies, and both including the nonprofit and the for-profit sector. So we've become this large alliance of over 150 companies from across the country that have come together to really build public goods for healthcare in India. And we are focused on broadly two things right now. So one is technology. So this is building off of the work. And frankly, 1MG was involved in this. Amfine has been involved. We're very grateful to the volunteer time from all of your companies, because we've had volunteers from across the ecosystem come and help build this tech. So one part of our work, one pillar of our work is technology. So in technology, we've got the telemedicine software that we've built, again, based off of the work that the industry contributed. And we are now taking a piece of that, which is the provider platform, and making that open source freely available to the last mile providers across the country, which we think will go a long way in actually digitizing the last mile. And that's frankly a market failure, which is where we think a nonprofit like SWAST can play a role. Because as most of you know, the private sector has found it really hard to penetrate the last mile when it comes to the provider ecosystem. So that is one piece of work. The other piece of work that we're doing is we're really working on standards. And we worked on two kinds of standards. One is information exchange standards. So again, the team with volunteers from across the industry over the last 4 to 5 months have put in over 3,000 to 4,000 man-hours in actually building out information exchange standards for health claims. And this is really important, because what this will do is that it will help providers submit claim information electronically to insurance companies, dramatically reducing the cost it takes to process a claim. Right now, insurance pays out between 10 to 15% on just claim processing. And so it will decrease the amount of money that is spent on claim processing. It will also reduce the amount of fraud that insurers see. And then for the providers, it will actually dramatically reduce the receivables, because they wait between 40 and 60 days to get paid. So to us, this is again a very foundational change that we are hoping will spur a lot more innovation in the financing landscape and allow newer and newer products to be created. And to us, all of these, the technology, the standards, the financing, all of this is leading to this vision that we see for India of integrated healthcare. And here what we want to see is we want to see integration across all levels, vertically as well as horizontally. And when I say vertically, I mean preventive, primary, secondary, and tertiary. When I say horizontally, it could be a lab, pharmacy, and a clinic, or it could be even public and private, because we have extreme fragmentation in care in India. And we have an opportunity to use technology to actually link up these patient journeys. So that is really what SWAST is focused on. So we're a Section 8 nonprofit that has the entire industry as shareholders, with no controlling stakeholder and a very patient-centric ethical governance model, where we've come together not to become another lobby, because again, there are very good lobbies in healthcare. What we want to do is we want to be a private sector organization which is committed to the national interest, that is committed to sharing IP, that is committed to sharing know-how to build for India. And especially to build for this missing middle, because you see the top 150 million people will access high quality private care. The bottom 40% will eventually get covered by government schemes like Ayushman Bharat, but that still leaves between 500-600 million people that we sort of see as the missing middle that don't have great access to care. And to us, that is where a lot of innovation is needed. The government will not be able to really serve them in the near future. The idea is that we should incentivize the private sector to really start innovating in that sector and create newer kinds of financing models, newer kinds of care model. And that's where I think India really needs to innovate. And frankly, we also feel like once India is able to create these models, this could apply to many other low and middle income countries that face very similar problems. And SWAST as an organization is very, very excited to be a part of this journey.
Yeah, no, and that's a very unique model of private players coming together voluntarily to create a platform. I think not many examples. In fact, the recent one in the US kind of broke apart, unfortunately, which was the Amazon Berkshire sort of partnership. But healthcare is anyway challenging, and which is why taking from that, you raised a very important point, which is like healthcare as an integrated delivery model, and not just sort of a piecemeal item. And I would like to sort of take that question, or hear thoughts of Ashutosh, because I know specifically Amfine is trying to solve the problem, at least a portion of the healthcare problem, which requires the doctor-patient interaction. And how are you sort of what kind of challenges are you facing there, or at least the opportunities that you see, and then your thoughts, starting from, let's say, vertical, and perhaps your thoughts on integrated healthcare, like how does this model move to a more integrated offering?
Yeah. Hey, thanks, Tanmay, and good afternoon, everybody. Thanks for providing the opportunity. So let me just talk quickly about Amfine and what problem we are trying to solve. See, we believe in India, access to quality healthcare is not solved. So, be it any tier 3, tier 4, or rural areas, or be it metros, accessing healthcare and quality healthcare is a cumbersome process. In some of the geographies, we don't have availability of the doctors, and while in metros it becomes quite cumbersome to access and reach out to the doctors. So what we believe, since mobile internet has penetrated in India pretty much in nook and corner, so we would like to build a virtual hospital, and that's what we call Amfine is. It's a service which is available on demand and solving pretty much access to quality healthcare. Apart from that, we believe there is no platform which is pretty much providing the health management or creating the overall system where patient is having his digital health records, and he's also having control of his health records. So I think Amfine is trying to solve all these problems, and by and large, the way we are trying to integrate the ecosystem by aggregating large institutions like hospitals, diagnostic platforms, and also integrating with medicine delivery players. So, pretty much trying to bring complete end-to-end healthcare onto internet and trying to deliver health as an internet service, on-demand service, and trying to integrate with ecosystem, especially private ecosystem, where we could pretty much bring the digitization of healthcare delivery. So that's what we have been trying to solve the problem, and obviously post pandemic we have seen a lot of changes in terms of in the ecosystem, where ecosystem has already geared up for adoption of digital channel for healthcare delivery.
Yeah, very well. And I think in India, one of the issues, at least, that we have also seen is the provider side of the problem is pretty challenging, right? Because you have on the one side, particularly access to sort of quality providers, doctors, and sort of platforms that are being built to create a network of doctors, like becomes a big challenge in terms of how do you both access and then incentivize in a way which is sustainable. So for me, like even from 1MG's perspective, that has certainly been a challenge. So would love to hear Dr. Jain's view on that, because he's solving also a very unique portion of this problem, and has seemed to build a pretty solid sort of provider-centered network and platform. So, Dr. Jain, why don't you share, what challenges did you face, and what is the opportunity that you're seeing on this side of the healthcare problem ecosystem?
Yeah, thanks, Tanmay, and good afternoon, everyone. It's 2:30 a.m. in New York right now,
Oh,
so
you're
pardon me if I talk a little nonsense as well in between. So the problem that we are trying to solve and how it fits in the overall ecosystem, because we find it kind of a very unique, because whenever we saw anyone talks about healthcare, it kind of diverts more towards the patient, because that kind of takes the bulk of the share of healthcare ecosystem, right? And most of the businesses are trying to solve the big problems in healthcare, which is either access or affordability, right? So we are trying to take a different cut on affordability, right? So across the globe, there are so many businesses that have set up, which have tried to make people healthy, right? If whether it is a disease management or a case management or reducing access to care, everything is intended to reduce the cost of care and hence make healthcare affordable. One of the other big pies in the overall healthcare spends, if you see, is the cost of drugs, which is only growing northwards, and it is not coming down. So our intent is to focus on that particular problem statement. How can we reduce the cost of drugs? Right? So there are two biggest components in the cost of drugs. It's the research and development, and second is marketing. Right? So R&D, we saw in the case of COVID vaccine how everything got accelerated, versus a typical drug development takes 5 to 7 years and $2 to $3 billion. Right? It all got changed, or the system showed how efficient they can be by bringing a vaccine in less than a few months. So on the marketing side, it contributes to 25% of the overall expenditure in the cost of drug, right? And if you look at pharma marketing, is kind of laggard in terms of adoption of data and digital marketing, which can potentially make it a lot more efficient and effective. That's what we at Docare are trying to solve. How can we make physician marketing effective and efficient? And our estimates based on the data available says we can reduce the cost from 25% to less than 18% globally. That could be like a huge, that could bring the cost of healthcare down significantly. And it is not apparent from the way we position the business, like not the social side of it, But on the commercial side, what we're trying to do is we're trying to aggregate all possible platforms that physicians visit for their professional purposes. Just like consumers, they visit so many sites. Physicians are consumers and professionals also. So the professional side of the ecosystem where they spend time, like the medical journals, like the telehealth platforms like Amfine, the EHR platforms, the physician networking platforms, or even the medical association networks, right? And if you look at any physician journey, they spend more than 50% of their digital time on these platforms, right? Which is fairly significant. And whenever they are on these platforms, they think about patients. They are thinking about a difficult case. They're thinking about a management. So highly contextual environment, which can help in educating these professionals through the right media. And as Ashutosh said, the penetration of internet in India is one of the highest. And if you look at the stats, the medical education for doctors in rural areas is very difficult because pharmaceutical brands are considered to take a lead role in educating the physicians, and their penetration in rural areas is limited. So we believe we are playing a greater role there as well in advancing medical education to hard to penetrate areas. So this is in nutshell what we are trying to address: the cost of healthcare by focusing on physician education to reduce the cost of marketing.
Very interesting way of approaching the problem. Depending on what numbers to believe, I think the ratio of doctors to patients or people who want consulting is fairly good in India and other developing countries, right? And it is a key challenge to figure out, qualified healthcare providers and make them accessible to the public in general. I want to also talk about a topic which is more relevant and recent for all of us, and the world is still going through the pandemic phase, and particularly, what opportunities and what shift in user behavior has been witnessed because of this challenge. And again, Dr. Nair's view on what have you seen, given that the original sort of starting point was a telemedicine platform, but share some insights and some thoughts on how have you seen during the evolution of the pandemic, the evolution of the platform itself.
So I think the thing that age during this pandemic is the idea of, and one could call it many things. We often use the term telemedicine, but it's frankly teleconsultations. And teleconsultations have really come of age. If you look at India, where it was essentially a gray area right in the beginning of the pandemic, the government was very forward thinking in terms of putting out these telemedicine practice guidelines, which are now out. So teleconsultations have moved from being a gray area that doctors were unsure about to something that almost everybody is now engaging in. You had similar moves happen in the US, where you could actually practice cross-state because you had cross-state licensing issues, which has also been now changed. So I think there's a lot of changes that have happened on the regulatory side in allowing teleconsultations to happen. But more important than the regulatory side, I think during the lockdowns, there's been a fundamental shift in behavior. And I've been talking to doctors about technology for the last 10, 15 years, and I haven't seen this much interest in technology amongst providers as I have during this pandemic, because suddenly everybody was sitting at home and they could not physically access their patients. And pretty much any doctor of any kind in India who does outpatient visits has done consultations. Now, they could have done this on the phone, they could have done this on WhatsApp, might have used platforms like yours, but pretty much everybody. So to me, what shifted is this fundamental behavior shift. Patients have become a lot more comfortable. Another thing that doctors would tell us is that while patients have always bugged doctors on WhatsApp and on the phone, not many were willing to pay for it. And what's also happened during the pandemic is that payment behavior is also set in. So both on the patient side as well as the provider side, I think there has been a fundamental shift in behavior. Now, obviously, you've seen this massive peak during early in the pandemic, which has come down. But what's happened is the baseline has shifted because a lot of people are now used to this new behavior, and I think that will sustain. This shifted baseline will sustain. And that's probably the biggest shift in terms of technology use as far as healthcare is concerned. There have been other shifts elsewhere in the value chain. So, for example, we have seen, and again, we've been supporting as SWAST as an alliance. We've been supporting this in multiple districts in India. They've been in secondary and tertiary care. We've seen tele ICUs, for example, take off because again, you've seen a lot of value in getting qualified, high quality advice to areas where there isn't manpower and infrastructure. So you've seen this sort of fundamental shift on outpatient behavior, but you've also seen this happen across the spectrum. And things like ICUs, for example, we work with an organization called Cloud Physician, who've been able to work with very rural tribal districts in Maharashtra, where there are government hospitals, established ICUs, but no doctors. They've been able to set up a very simple link and train up the nurses, train up the available manpower, and they've been able to actually run these ICUs from control rooms in Bangalore, and which, frankly, a year ago would have been a very hard sell. The problem still existed. Even a year ago, there was no, there weren't enough doctors in that area. There were these beds there, but I think COVID has pushed people to really start thinking out of the box when it comes to tech solutions. So to me, I think that shift has happened. I don't think you will see a massive explosion of technology use right after. I think you had this sort of steep ramp and then ramp down and a higher baseline, but you will see a lot more people willing to look at newer and newer tech solutions. So I think from a healthcare technology standpoint, it's going to be a very creative and exciting few years as more and more people are used to tech and start using more of these solutions.
Yeah, and Dr. Jain just mentioned, and we all know, particularly this sector has been a bit of a laggard, as he was saying, in the adoption of technology. Right, some of these forces are great, at least for the sector to start looking at the innovative and technology solutions more seriously. And one of the, we all understand that the efficacy of some of these healthcare platforms also depends on the usage, right? So now that there is more adoption and more usage, there's a lot more, valuable information that we get that we can use for better delivery of health, right? And that's something, again, I want to hear Ashutosh's thoughts, because that's something that, they are doing. They're using technology to sort of get better understanding of the patient and doctor conversations, healthcare delivery. How are you guys seeing this change post COVID? With the enhanced usage of your platform and utilizing that sort of tailwind into better delivery of healthcare solutions.
Yeah. So I think pandemic has definitely increased the adoption towards supply side as well as demand side, and we have been seeing behavioral change both ways. And government has also provided enough support. They pretty much came up with clear guidelines around telemedicine. So whatever are the reasons now, every institution wants to have a digital presence. A lot of doctors have moved to digital consultation. The overall ecosystem is pushing for more and more online healthcare delivery process. Even pharmaceutical companies also, they are coming into the ecosystem and pushing for this, and so that they can reach out to their doctors more digitally. So overall ecosystem is gearing up for this, and what it will provide more and more digital health data. So far, I think in Indian healthcare ecosystem, we have not seen business model coming up for keeping patient healthy. So far, all the business models are or incentives are line towards like when patient gets sick and you cure the patient and then you get incentivized. But there are no models. Those are in the direction of where you could keep patient healthy. And then fundamental reason behind that is Indian healthcare ecosystem, health records, digital outpatient health record, or health record which could be utilized for benefit of patient health, they don't exist. So now, at least digital has been pushing that forward, and we being on the front runner of digital health platform, definitely we have been gathering a lot more patient information, and now NDHM has also come up with health ID project. So hope all the patient data and health information will get tied with that particular health ID. And post that, not only Amfine, I'm sure there would be many other organizations which would start mining that data and probably creating products. Those would be helpful for the patient, and then they would try to keep patient healthy because there's a history. They can track the health data. There would be integration with devices. There would be care management and health management platform. Those would be coming up, and the objective would be how to keep patient healthy, and those kind of business models would come up. And certainly, Amfine has been going in that direction where we are trying to come up with sort of a health management platform where we could probably early detect something and then make sure the patient is keeping himself healthy, and this is all based on his health data. That not only will reduce overall burden of diseases, it's definitely a right direction for healthcare delivery, and I'm sure those right models are going to come up probably next couple of years, or they would be scaling up, I believe.
Yeah. And I think you made a very important point, which is that most models, in fact, the world around are mostly delivery-based models, not care delivery-based models, and not outcome-based models, and that has been one of the bane of the industry, right? So the incentives are misaligned, and most folks, most institutions, uh, our incentives are set in such a way that it's basically just as much delivery, and disconnected from outcomes, right? So I wanted to get, Dr. Jain's views on how do you think this will evolve or change, right? How far are we in India, from moving from a just delivery-based healthcare model to an outcome-based healthcare model?
That's I think, a great question, and it's a massive transformation also, if it happens. So I often compare models of different healthcare models of different markets. So I'm a trained physician who used to practice in India, then practiced in US, and then decided not to practice at all. So there is a point of view there, how I often try to compare. If you look at even US healthcare system as a model, although the intent is to move towards outcome, but they're still far, far away from being able to deliver that to any extent. Right? Uh, Having practiced here, although as an outsider, the US healthcare system is considered very advanced, but I found Indian healthcare system to be at a very, very strategic position with the right initiatives that the government of India is taking right now. It can be steered much ahead of the developed countries' models, right? And this is a very controversial statement to make, and there are reasons to believe. Like everything has to be centered around data, which is what India is trying to do right now with NDHM, Health ID, and they being able to map all the data together. It's an Herculean task. Won't be easy. Even US has been trying to do that for last so many years. They haven't managed to achieve. There are models that exist which are more smaller countries in the world where aggregation of such data is easy. And that I believe is the starting point of any initiative which India has started, gathering all the data together. Right? You touched on a very interesting thing, that the doctor patient ratio. I often say that it's $1 million question, that no one in the world still knows how many doctors are there in the country. right? Such a basic piece of information doesn't exist. If you look at the regulatory authorities, the number of doctors is over a million, right? And those doctors exist since 1912. Different estimates show different data points. So I'm not sure how a doctor patient data is even calculated, right? And if I combine the entire IU system of medicine, which kind of drives the bulk of the healthcare system at the bottom of the pyramid, we will not have a low doctor patient ratio for sure, right? So again, coming back to data, I think data will help in solving a lot of problems, will also help us in finding out how many doctors are there in the country, right? So that's one part of data and how the healthcare system is evolving. Moving to an outcome based delivery model. See, I believe apart from data, culturally, we are not kind of inclined in that direction. If I think as a patient, do I get my, so I know it's important to get a health check done every year, right? Do I do that? No, right? It always looks good on paper, but culturally, we are very, very reactive people. We only respond when something happens. Otherwise, no news is good news. We always want to avoid the bad news, right? My wife keeps nagging me, get a health check done. I said, no, no, it's not the right time. I'm traveling too much. My readings may not be right. So I kind of try to defer that always, right? And so I believe we are far from that direction, far from reaching there, but we have at least started moving in that direction, which is a good thing.
Thank you. Yeah, I agree. Which is why also, uh, again, another very important point and observation that you made, that one of the benefits that India has is that it is not encumbered by some of those, you know, bizarre healthcare systems that were not created with that intent, but somehow over time, particularly the US example that you're talking about, in how the creation of that system has only increased the burden of healthcare costs in a country like the US, which perhaps even with the advancement in healthcare has one of the highest sort of healthcare costs amongst all developing countries and all countries, period, right? So almost 14% of GDP is in the healthcare, sort of going into the healthcare. And part of it is, large portion of it is the inefficiency of the system that is being built, right? So I am very curious to hear Dr. Nair's view that India certainly has the benefit that it is not encumbered by those gargantuan systems. The three party model, the payer is different than the provider, and the beneficiary is subject to ever increasing insurance costs. Maybe there is a better model. And one of the points that Dr. Jain made is that early sort of putting together data and records in place certainly helped us moving in that direction. From your vantage point, what are you seeing, and what are your views on this? Right, given that India's challenges as well as the solutions that we'll see will be different from what you see in the West.
No, I think it makes a lot of sense. The earlier idea of leapfrogging, and to me, we don't have a lot of legacy in terms of organized healthcare, because if you think about how healthcare is, you have a very tiny segment of the healthcare market that is actually organized. Most of it is unorganized. Most of it is very fragmented. And as healthcare financing grows, so if you look at private insurance that's growing in double digits every year, you have this massive expansion of public financing, and private public insurance also growing. You will start seeing consolidation, you will start seeing organization. And I think we have an opportunity to not repeat the mistakes that we have seen elsewhere in the world, especially in the US. But I think it also requires a fundamental shift in thinking on our end, in terms of how we pay for value, and this idea of outcome-based payments, or this idea of value-based care. And I think even today there is an opportunity to start creating some of these benchmarks. So, for example, if we were to look at a capitation system, then we today don't have a benchmark as to how much does it cost to keep somebody healthy at a certain age, right? Which is sort of will be a core benchmark for a capitation based system. If you're looking at value-based payments, we don't know what outcomes that we should be measuring, what are the benchmarks for India, and then what are the right premiums or incentives to be paid for those outcomes. So to me, there's a lot of foundational work that needs to be done right now so that we can actually build a better health system. The other point to that is that if you really look at how our population is spread, if you look at the amount of human resources we have, and there are no models to copy. We can't go and find, look at the Scandinavian model and say, let's just copy and paste that and this will work here. We need to create a new health system in India that is uniquely Indian, that takes into account how Indians access healthcare, which is also, if you look at, and again, across society, right from, the high income group down to the bottom of the pyramid, you will see that people actually in practice do a lot of integrated care. They would go, get yoga, Ayurveda, and actually combine all of these modalities in their care-seeking behavior. And I think we should actually encourage a lot of this because a lot of our traditional systems are very preventive and are very health promotive as opposed to just reactive. So we do have some strengths here, just in terms of traditionally how we see health. But we need to be able to integrate all of this. We need to be able to incentivize, and there's an agency problem also in healthcare because there is a significant amount of information asymmetry between the provider and the patient. And it is true that often when you talk to people about healthcare, so let me step back for a second. So I think if you ask people in any country if they're satisfied with the healthcare system, people will say no, right? Like, so if you ask the British, they don't like the NHS, but if you take away the NHS, they'll all start crying. I think the human baseline is that we are not satisfied with whatever level of healthcare we have. But I think that that said, India has some very specific challenges in healthcare. And if there is all kinds of practices that happen that are unethical, not really patient focused. I've spent a lot of time in rural India and I have seen the kind of it's a little crazy to even describe what happens because you essentially have all of these guys advertising all kinds of rapid cures for everything from cancer to HIV/AIDS, which are plastered over billboards. There are touts that go into villages and pick people up and bring them to hospitals. So there's all kinds of these practices that happen, which I think are counterproductive in terms of building the right health system. But to me, I think we need to start moving towards. We need to understand a few things. One is that we need to invent a model of our own. The model needs to be fundamentally different from what we are seeing in the West. It needs to integrate our traditional practices as well as modern medicine in a very cohesive way. And it needs to really work towards making sure that everybody in the healthcare value chain is incentivized to keep the patient healthy. Because if you think about where innovation happens, the private sector innovation really has happened where there are margins. And unfortunately, margins are at the wrong end of the chain. So there's margins in tertiary care, there's margins in secondary care. There's no margins in preventive and primary care. And therefore, you haven't seen a lot of innovation happen in preventive and primary care. So to me, these are some of the fundamental challenges that we will have to grapple with to create a better health system in India.
All right, thanks. I think we're out of time, so there's a few questions. I thought maybe you can just take one of them. Sorry about that. I think there's a question. I'm trying to access it in my screen. Sorry, just give me a second. Yeah, so there's an interesting question that given all the technological investments and infrastructure changes, who is expected to bring more change in the health ecosystem? Small startups or bigger tech giants? Always. I thought it was an interesting question. Who wants to take that? Maybe Dr. Jain, you want to take that question?
Controversial questions for me.
That's why I thought of raising it.
Yeah. So I think there is enough data. We had a lot of discussion on data that I think startups have led the change across industries, although there are massive organizations which are still startups. So I have no doubt, and I think what Dr. Ajay also mentioned, that there is no commercial aspect in the preventive and primary care. So I have no doubt that only a startup can find a commercial angle and find a way to disrupt and innovate in this ecosystem. big giants, it would be very hard. They can maybe invest as part of a CSR initiative, but CSR initiatives cannot disrupt or innovate or solve big problems like these.
Yeah, great. Anyway, I think we are out of time, but thank you so much, gentlemen, for your views. I hope it was as useful for the audience as it was for me. And over to you, Aparna.
I would like to thank all of our speakers who made this discussion super exciting and enlightening. Thank you so much, everyone. I would also like to take this opportunity to thank our diamond partner, Google, our platinum partners in Movie and Facebook, digital growth partner, Microsoft, and omni-channel partner, Zen. Thank you, everyone. And don't forget to check out our virtual expo booths. Thank you, and have a
Big
great day.
giants, huh?
Thank
Thank
you.
you.
Thank you all.